You were scheduled for an out-of-OR case in the radiology suite for a radiofrequency ablation of a liver nodule in an obese male with a BMI of 41. After induction, you are unable to ventilate. What would you do next?
I would first insert an oral airway and perform a bimanual jaw thrust, asking a nurse to squeeze the reservoir bag.
The patient's saturation drops from 100% to the low 90s. Ventilation remains ineffective. What is your next course of action?
I would ask the nurse to call for another anesthetist and to bring the emergency airway cart. In the meantime, I would attempt to intubate, preferably with a video laryngoscope, if available.
There is no video laryngoscope, and your first direct laryngoscopy failed. What do you do next?
I would insert an LMA and again attempt to ventilate. Also, based on my view, I might consider repositioning the patient, changing the blade, or using a bougie for my next attempt at laryngoscopy.
You failed on your second attempt after some position changes and external laryngeal pressure. Would you change the blade and try again?
I would not try again unless I strongly believed that I would have a reasonable chance with a different blade. Instead, I would ventilate with the LMA while waiting for help, the emergency airway cart, or the video laryngoscope prior to another attempt at intubation.
You can't ventilate with the LMA. What is your next step?
Ideally, I would wake the patient up. If that's not possible, I would call for a surgical airway.
The surgeon is 20 minutes away and the patient is not waking up. His oxygen saturation is now dropping to the 60s. Would you try a fiber optic intubation?
No, I would not attempt a fiber optic in this emergency situation. Instead, I would administer a paralytic if not already given, and if still unable to ventilate, I would perform a cricothyrotomy.
Why not a tracheotomy?
A cricothyrotomy is faster and has a lower risk of vascular injury. Also, I am more comfortable performing a cricothyrotomy than a tracheotomy.
You can't locate the cricothyroid membrane in this obese patient. What do you do?
I would perform a midline vertical incision on the presumed location and then try to palpate the membrane. Then I would insert a needle while aspirating for air. Once in the trachea, I would pass a guide wire and then dilate. Next, I would pass the cannula and confirm appropriate end-tidal CO2 return.